During this session, we will consider foot problems related to inflammatory arthritis, other possible causes of foot problems, medication, self-management, managing some common foot problems, how to get help, and other sources of information. So there are around about 200 different types of rheumatic disease, and they fall into four main groups: inflammatory arthritis, osteoarthritis, regional musculoskeletal pain, and back pain. And obviously inflammatory arthritis is the group that we're considering today. So in these disorders, the joint lining, the synovium, becomes inflamed. This can damage the surface of the joint and the underlying bone itself. We usually find that many joints are affected, and rheumatoid arthritis is an example of this, as are psoriatic arthritis and gout. So this slide shows a representation of a joint badly affected by rheumatoid arthritis. Obviously you can see that the synovium has become very inflamed, and it's started to erode away the cartilage and the underlying bone itself. The cartilage has become quite thin. You can also see that the tendon sheath has become inflamed, and you would expect a joint affected in this way to become quite hot, swollen, stiff, painful, and potentially misshapen. Obviously not everybody's joints are affected to this extent. So moving on to the foot, what makes up the foot? 26 bones. We tend to have long bones comprising the front part of the foot, and the rear of the foot is made up of more cube-like bones. There are 19 muscles and associated tendons. Intrinsic muscles begin and end within the foot, and extrinsic muscles tend to originate within the leg and end within the foot. We have blood vessels, obviously arteries bringing oxygen-rich blood to the tissues, and veins then returning the deoxygenated blood back to the lungs. There are nerves, sensory nerves responsible for sensations such as feelings, temperature and pain, and then motor nerves obviously responsible for initiating movement. We all have different feet. Some people may have a particularly high or low arch to their foot, or a more mobile or rigid foot type, and these foot types can be inherited. Our lifestyles and activities can also have an impact upon our feet and the foot appearance and function, as can injury or surgery. So there's an awful lot that can affect the foot. Inflammatory arthritis can make the foot more unstable and at risk of changing shape, and so you can imagine how an inflammatory arthritis can make a previously symptom-free foot condition problematic. So foot problems can affect any of us. As you can see from this slide, we have a variety of concerns in our clinics, from structural changes, nail and skin conditions, to corns and calluses, which left untreated can develop into ulcers. So up to 90% of people with this condition will report associated foot problems. For some people, the foot is the first area of the body to present with signs and symptoms of rheumatoid arthritis, and for others it may be months or years, or they may never experience any foot problems at all. Okay, so when people come into our clinics, there are a number of ways that they describe their foot pains to us. I'm sure you're all familiar with a number of these descriptive words, but the end shot is that obviously they will affect any of these pains, any of these sensations that you are feeling will affect your activity and your function. Okay, so as I mentioned earlier, rheumatoid arthritis can make the foot more unstable and at risk of changing shape. You can see from the slide deviated rear foot position and collapsed midfoot, which can cause overloading and strain around these soft tissue areas and joint structures. The forefoot can become widened. Toes can become dorsally displaced, which can cause friction and damage across the tops of the toes and also onto the ball of the foot. Appropriate footwear is important in accommodating these vulnerable areas, or surgery may be required to realign the foot structure and alleviate these high pressure sites. Substantial forefoot surgery may result in large differences in foot length.
Sorry to interrupt you, what does dorsally displaced mean? I mean, what does that look like? Which one?
So dorsally displaced toes are toes that instead of sitting sort of straight onto the end of the foot, they rise up slightly. So the middle, these are dorsally displaced. So they're sitting just a bit higher up onto the top of the foot.
Lovely.
And the amount at which they move up, or rather the more that they move up, the more that they displace, obviously the more friction you'll get across the tops of the toes, the more pressure and more problems potentially you can get. So one of our main aims within rheumatology podiatry clinics is to see our patients as early as possible to try and identify these overloaded or at-risk sites and ensure that the feet are well protected and supported structurally so that we keep them looking like this. So protection of the joints is important. We aim to encourage stability, avoid joints working at the end range of motion, and reduced falls risk. Advice regarding joint protection can include footwear choices, insoles or foot orthoses, and exercises to improve strength, mobility and balance. Moving on to medication. DMARDs, disease-modifying anti-rheumatic drugs, we're all familiar with these. They tend to be given early on in disease, and they've been shown to have a positive effect on disease inflammation and joint destruction. Certainly on X-ray, methotrexate has been shown to slow down or halt joint damage, and they have an important place to play in the battle against inflammatory arthritis. Ongoing research and development will always bring newer medication options. Over recent years, biologic medications have significantly helped many people, and there are a lot of different biologic medications on the markets now. And these help to control inflammatory levels, which helps to improve the symptoms of inflammatory disease. We do need to be aware, however, that inflammation is normally the way our bodies deal with infection, and so medications that affect this process will have a powerful effect on the immune system and that can reduce its ability to fight off infection. And this is compounded by the fact that the medication can mask the usual signs of infection, such as a fever or pain or redness and inflammation. So this slide just highlights these factors really. The medication, as I said, can reduce the signs and symptoms of an inflammatory arthritis by reducing joint damage and helping to increase mobility. But a reduction in the immune response and masking of the normal signs of infection can increase the risk of infection. And as you can see in this photo, there's only very slight redness to the dorsum or the top of the foot. But when taking a look underneath, there's a little swelling and peripheral redness, but the skin is definitely not very happy. And this is why it's important to ensure that you're checking your feet. As I said, this is an example of where you clearly have, or that there is clearly an infection, but with the medications masking those usual signs, it's not quite so glaringly obvious straight away. So prevention is key. To prevent problems, you need to be self-aware. From the podiatrist's point of view, we encourage patients to be in the habit of checking their feet regularly. It doesn't take very long, maybe half a minute just before you get into bed every night, just having a quick look at the bottoms of the feet, making sure there's no cuts or grazes or anything of that nature. And if you're looking at them very regularly, you can spot very quickly whether or not something is wrong. A sore throat, fever or skin wound also need to be checked and not left. We need to be mindful that common signs of problems such as fever, redness or pain may not be obvious as a result of the medication that you're on. If you have any concerns regarding infection, you need to ensure that these concerns are checked by your GP or your rheumatology team to make sure that it's safe to give yourself your next injection. So there are many things to consider that should help with your arthritis. Lifestyle choices are important. Good dietary choices, controlling your alcohol intake, obviously stopping smoking, maintaining a healthy weight, and your GP obviously will ensure that your blood pressure and cholesterol checks are kept within normal limits. Exercise is very important to maintaining function, and it's important to remember that exercise will not damage a joint, and everybody is different, so to choose something that suits you. Or ask to be referred to an exercise programme if you feel that you need some guidance. Always be guided by how you are feeling, making sure that you pace yourself and listen to your body. If you feel you need a short break or rest, then have one. You certainly won't benefit from trying to keep on going or trying to work through the pain. Pacing yourself is something that you'll hear very regularly, and it really is very important.
How do you be referred to an exercise programme?
Well, it will vary depending on where you live, but the first access would be via your GP, and they will be able to point you in the right direction and let you know if there's anything available locally. Also, you could contact your NRAS, local NRAS group, maybe see if they've got anything running locally or whether they could give you any advice regarding that. So now we're just going to have a few brief slides about looking after your feet and just some sort of general helps and tips and hints and advice. Okay, so looking after your feet. Obviously you need to ensure that you have well-fitting footwear. You need to make sure the footwear is obviously wide enough for the foot and long enough so that you're not causing any cramping or rubbing of the digits within the footwear. When looking after your feet, it's important to make sure that you carry out your nail care very well yourself, if you're able to do that. Cutting them straight across, just gently rounding the corners and just filing them smooth so that you don't catch them. Using a cream, obviously, to try and maintain good skin condition is very important. Try and avoid using anything too sharp, a razor or anything like that on your feet. We have a lot of people that come in who have damaged themselves using various implements to try and achieve their foot care themselves. When looking after your feet, all of these aspects are if you can manage them. You know, if you can't get down to your feet, or if your grip strength is poor and you're not able to manage it yourself, then don't attempt to. These are only advice tips for if you're able to and happy to get down and do them yourself. So avoid using sharp instruments yourself, and corn cures and various treatments like that. We would always suggest people try and steer clear of. They tend to have acid within them, and so if you put them on the wrong place, or if you leave them on for too long, then they can cause more damage, potentially create a wound. As I said, corn plasters can create more problems, and this shows a picture of the effect of a corn plaster on the skin. Obviously somebody's put it over a corn to try and remove that corn themselves, but it's actually macerated and damaged the surrounding skin, and then this area now is much more vulnerable to tissue breakdown and potentially a wound developing. So we would always advise our patients to steer clear of corn plasters. Sometimes, if you don't have relatively normal nails, as we would say, you just can't manage your nails yourself. You might have a particularly involuted nail, so a very curved nail plate, particularly thickened nail. You might have had damage to the nail, which has caused the nail to become distorted and disfigured. And as I said, you know, sometimes it's just something that you can't manage and you need some help with. So don't try and attempt it if you're not happy and able to do so. So these ones definitely would need help. There's an ingrown toenail. Well, there's a couple of ingrown toenails actually. The beginning of one on the left and in the middle a full-blown one. Fungal infections. Here a very thickened graphotic nail, and on the right there, that's corn underneath the nail plate. Any other areas of discoloration also beneath the nail plate would need to be checked for a possible melanoma or something of that nature. So it's always good, if you're not sure, to get something looked at. Athlete's foot is very common. Tend to get it sort of between the toes on the hole, although you can obviously get it across the bottom surface of the foot as well. You tend to find that the areas will be particularly itchy, red and sore. For athlete's foot on the skin, it's very easy to treat, very quick to treat. Usually would use a topical treatment, a cream or a spray, dependent on what you find easiest to apply. The regularity of treatment will vary dependent on which product you purchase. But you would usually find with a cream, for example, you would use it twice a day, every day until the symptoms go. And then once the symptoms have disappeared, we would advise you to continue to use it for approximately a week to make sure that all the fungal spores have been killed. Once you've sort of got rid of your athlete's foot, it's a good idea to try and use surgical spirit between the toes. That's astringent, so it'll dry the skin out. Because athlete's foot tend to thrive in sort of warm, moist environments, and when the toes are quite snug and quite close together, which we sometimes find when people have got an inflammatory arthritis, it's very difficult to get in between the toes and dry adequately. So you dry as well as you can, but then if you use surgical spirit, as I said, maybe once a day, every other day, that'll help to dry the skin out and make sure that that skin condition is maintained. Always check inside your shoes. Check inside with your hand is quite handy. You can pop your hand inside, making sure there's no ruckles within the shoe, upper or liner, which can sort of damage the skin. Check that there's nothing obviously fallen into the shoe, stones. Had a number of patients come in with various stones sat underneath the insoles of their shoes. They sort of walk in and say, oh, they're a bit uncomfortable today. You sort of pull the inliner of the shoe out and there's stones stuck in the liner of the shoe underneath the insock. So it's just important to just try and have a regular check of the insides of your shoes and making sure there's no sort of obvious foreign objects or wear and tear that needs to be addressed. Try and avoid walking barefoot. There are a number of reasons we try to advise people to avoid walking barefoot. Number one is to protect the tissues. Obviously, if you're walking around your house, who knows, a staple might have fallen out of a letter, or you might have dropped a glass and not quite swept up every last splinter. So protecting the skin itself. And also for joint protection side of things, to ensure that the foot structure itself is well supported and kept in as good alignment as possible for the largest portion of the time. avoiding direct heat. Again, in relation to maintaining the good condition of the skin. This is obviously not just sort of things like radiators or heaters placed directly near the skin, but obviously simple things like sunshine. I know that's something not all of us know very much about, but avoiding sort of sunburn and that sort of thing. And some of the medications will make you more prone to sun damage. So, as I've said before, sort of washing and checking the feet daily it's a really important part of your routine. And noting any changes, and if there's anything that occurs that you're not sure of or that you need checked, then don't leave it, get it checked. Either via your GP, which would usually be your first port of call because they can put you in the right direction of who to access for foot care, or via your rheumatology team. So if you do need somebody to have a look at your feet, always ensure that you see a chiropodist or podiatrist. Obviously, we diagnose, treat disorders, diseases and deformity of the feet and legs. The titles are protected, so you can't call yourself a chiropodist or podiatrist unless you are appropriately trained to do so. And this is protection for you, obviously, to ensure that the person who is looking and caring for your feet knows what they're doing.
When you have RA, is it advisable to actually be referred automatically to a podiatrist, perhaps particularly at the beginning when you're diagnosed?
The guidelines do recommend early referral, but provision does vary greatly dependent on where you live. We certainly, here, we try to see patients as soon as we can after referral to ensure that we are doing a baseline assessment to see if there's anything that we need to, any advice we need to give individuals or any support that needs to be provided straight off. And then also we sort of use that as a little bit of a session to give general advice on how to access podiatry if they require sort of help with general care as well. So certainly, definitely ask, but the provision does vary. The rheumatology team may direct you to your GP, but there should be some provision for you.
Should you also be referred every few years just to double check in case you've missed?
Again, it varies across. It varies geographically. Here, once we have a patient who's been referred to us, we will try and do sort of about an annual review, so that we can ensure that everything is kept an eye on. And if required, then we will also refer them to the community teams. If we're happy within the first 3 to 5 years that everything is staying relatively static, we'll then discharge patients, but with advice as to how to recontact us. An ideal opportunity to raise this issue would be at your annual review with your rheumatology team, and then they can obviously point you in the right direction.
Thank you.
So again, moving on to access for podiatry. Under the NHS, you should be able to hopefully access podiatry within your rheumatology team, or certainly within your GP, you should be able to access a community-based service, or privately, a private practitioner. As I said, as long as you ensure that they're calling themselves a chiropodist or podiatrist, then they will be appropriately qualified. Some workplaces will offer podiatry, and also some leisure centres will also offer podiatry as a service.